Prostate massage is one of the most searched and least clearly answered topics in men's health. Today I am going to give you the complete medical picture, what it is, when it genuinely helps, when it is dangerous, and what I actually tell my own patients when they bring this up in my clinic. I'm Dr. James Whitaker, board-certified urologist, and today we're going to talk about prostate massage, a topic that generates enormous curiosity among men and an equally enormous amount of misinformation online. I want to give you the honest, complete medical answer that cuts through the confusion and gives you something you can actually use. Let me start with anatomy, because everything I'm going to tell you makes more sense when you understand what we're actually talking about. The prostate gland is located in the male pelvis, directly below the bladder, in front of the rectum, and surrounding the urethra. It is roughly the size of a walnut in a healthy young man and grows progressively throughout life. The prostate produces secretions that form a significant portion of seminal fluid, nourishing and protecting sperm. Its glandular tissue is organized into lobules with a complex ductal drainage system that empties into the urethra during ejaculation. Now, the history of prostate massage in medicine. In the late 1800s and early 1900s, before antibiotics existed, prostate massage was actually a standard treatment for prostatitis, inflammation and infection of the prostate. This was the primary treatment available at the time, and in the absence of antibiotics, it provided some relief. With the advent of antibiotic therapy in the mid-20th century, prostate massage as a primary treatment fell out of routine use. But it never entirely disappeared, and there remain specific clinical situations today where it is used. Let me walk you through those situations clearly, because this is where most of the confusion exists. The first legitimate medical application is diagnostic. Before modern laboratory testing and imaging, urologists would perform prostate massage to obtain a sample of prostatic fluid, expressed prostatic secretions, for microscopic examination and culture. This helped identify bacterial infections and inflammatory conditions. While this technique has been largely supplanted by more sophisticated diagnostics, some specialists still use it in evaluating complex or recurrent prostatitis cases where other diagnostic approaches have been inconclusive. The second clinical application is in chronic bacterial prostatitis. Chronic bacterial prostatitis is a condition where bacteria persist within the prostate gland despite antibiotic treatment. The prostate's complex architecture allows bacteria to shelter within the ductal system, forming biofilms that antibiotics struggle to penetrate. In some treatment protocols, periodic prostate drainage through massage is used as an adjunct to extended antibiotic therapy. The mechanical disruption helps dislodge stagnant secretions and may improve antibiotic penetration into affected areas. This is not something done at home. This is a clinical procedure under physician supervision with appropriate antibiotic coverage. The third application, and this is where significant controversy exists in the urological literature, is chronic non-bacterial prostatitis and chronic pelvic pain syndrome. This is actually the most common form of prostatitis, characterized by pelvic pain, urinary symptoms, and sexual dysfunction without identifiable bacterial cause. Some urologists include periodic prostate drainage as part of multimodal treatment for this condition. The evidence is limited, and expert opinion varies considerably. If you have chronic pelvic pain syndrome and want to explore this with your urologist, that is a reasonable clinical conversation to have. Now, I want you to stop for a moment. If you're watching this and dealing with any kind of prostate symptoms, whether it's urinary issues, pelvic discomfort, or something else, please subscribe to this channel right now. I'm Dr. James Whitaker, and I put out detailed, honest medical content every single week. Hit that subscribe button and drop a comment below telling me what specific prostate concern brought you here today. I read every comment, and I want to help. Now let me address the claims you'll find all over the internet, because this is where I need to be very direct with you about what the evidence does and does not support. Claim 1. Prostate massage prevents prostate cancer. This is not supported by any credible clinical evidence. Prostate cancer arises from genetic mutations in prostate cells. The biological processes that lead to malignant transformation are not influenced by mechanical stimulation of the gland. No study has demonstrated that regular prostate massage reduces the incidence of prostate cancer. This claim has no scientific foundation. Claim 2. Prostate massage treats erectile dysfunction. Erectile dysfunction is primarily a vascular and hormonal condition. The mechanism of erection depends on nitric oxide-mediated arterial dilation and controlled venous restriction. There is no established biological pathway through which prostate massage would improve this process, and no quality clinical trial evidence supporting this claim. If you have erectile dysfunction, the interventions with real evidence behind them are pelvic floor exercise, aerobic exercise, vascular health management, testosterone optimization, and, when appropriate, PDE5 inhibitor medication. Claim 3. Prostate massage is essential for prostate health maintenance in all men. There is no evidence that healthy men with no prostate condition benefit from regular prostate massage as a preventive health measure. This claim is not supported by the American Urological Association. Now, and this is critically important, let me tell you when prostate massage is dangerous. If you have acute bacterial prostatitis, a serious acute infection of the prostate characterized by fever above 101 degrees, significant pelvic pain, difficulty urinating, and feeling systemically unwell, prostate massage is absolutely contraindicated. It is dangerous. Acute bacterial prostatitis is a medical emergency, requiring urgent antibiotic treatment and, in severe cases, hospitalization. If you have fever and significant pelvic pain, go to an emergency room. Do not massage the prostate. This is not a benign procedure performed without consequence when done incorrectly. Let me also address something that comes up frequently in my practice. Men who have read that regular ejaculation is beneficial for prostate health and have connected this to prostate massage. The research supporting frequent ejaculation for prostate health, which I cover in a separate video, refers to normal ejaculation, not prostate massage. These are different physiological events. The benefit of regular ejaculation for prostate health, as shown in epidemiological studies, is linked to the regular flushing of prostatic secretions that occurs through normal sexual activity. This does not require any external manipulation of the prostate. My clinical recommendation, stated clearly, prostate massage has specific, limited applications in chronic bacterial prostatitis and potentially in chronic pelvic pain syndrome, always performed under physician supervision with appropriate clinical context. It does not prevent prostate cancer, does not treat erectile dysfunction, and is not a routine health maintenance procedure for men without prostate disease. If you are considering prostate massage for any reason, have a specific conversation with your urologist about your individual clinical situation before proceeding. If you have prostate symptoms, whether urinary, sexual, or pain-related, please see a urologist for proper evaluation. The conditions that affect the prostate are well understood, the diagnostic tools are excellent, and the treatment options are effective. Self-treatment without diagnosis is never the right starting point. I'm Dr. James Whitaker. Thank you for watching. Subscribe to this channel for weekly evidence-based medical content. Share this with a man who has been wondering about this topic, and I'll see you in the very next video.